you have fracture line, particularly it is in this case two fracture line with a wedge fragment. In this case, you are going to have a wedge fragment. Is it clear? And then C is when you have a comminuted fracture, or you have a segmental fracture, as you're going to see in the diagrams. Now, A is going to be the first part. A is going to correspond to 3 numbers. Is it clear? A corresponds to 3 numbers, and that A is a fracture line without any fractured fragment. Now, if you have a bone, let's say that you have a bone as such, you have a fracture, like a fracture let's start with this one first. You have a bone as such, you have a fracture like this, but it is rotated in the other direction. Are you seeing? Like this. It is not directly fitting into this hole. Is it clear? So it is an oblique fracture, but it has been rotated. Is it clear? That one is called a spiral fracture. Is it clear? The next one after that spiral fracture, you have a patient that has a fracture, and then it's like this, and then you have the other part like this. This one is an oblique fracture. Is it clear? And then the third one now is you have a fracture like this, and then it's straight like this, up like that, it's straight like this. So this is a transverse fracture. Now, a spiral fracture corresponds to number 1, an oblique fracture corresponds to number 2, and a transverse fracture corresponds to number 3. So if a patient has a spiral fracture, is it clear? Immediately this patient has a spiral fracture, it is said to be A1. Is it clear? Immediately this patient has an oblique fracture, it's said to be A2. And if a patient has a transverse fracture, it's said to be A3. I hope you're understanding. This A is moving in conjunction with the different numbers that is going to have to be involved. Now B is going to be having 2 fracture lines, as you see here, with a wedge fragment. So let's visualize B. So in B, we are going to have, let's say, have a bone like this. If you have a bone like this, and then you have a wedge, this is a fracture of the wedge, but let's say that the fracture of the wedge is rotated. It is not in that direction, it is rotated as such. Is it clear? So you have a fracture like this, you have this wedge fragment which has been cut obliquely on both sides. Is it clear? But it has rotated, that fracture fragment has rotated. Is it clear? That is called a wedge. The wedge fragment which is spiral. So in this case you have a spiral wedge, is it clear, which has rotated in the other direction. The next one is when you have a fracture, let's say you have a fracture and then it is oblique. If you have a fracture like that, it is just obliquely cut as such, as you can see here like this. If you have just an oblique like this on both sides, it's not going to be called oblique, but it's called bending wedge. Is it clear? You have a bending wedge fracture. So is it clear? That's the second part. Now the third part, you have a fracture, and then you have a fracture is still wedge. Is it clear? But at the point of the wedge, you have many fragments on that wedge. Is it clear? You have many fragments on that wedge. It is still wedge, but you have fragments on the wedge. Is it clear? So it is called multi-fragmentary wedge fracture. Multi-fragmentary wedge fracture. Is it clear? Now you need to know that a spiral wedge fracture corresponds to 1, a bending wedge fracture corresponds to 2, and then a multi-fragmentary wedge fracture corresponds to 3. Are you understanding? So if you have a patient that has a spiral wedge fracture, it's going to be B1. You have a patient that has a bending wedge fracture, it corresponds to B2. And if you have a patient that has multi-fragmentary wedge fracture, it corresponds to B3. I hope you're understanding. Now the next one is C. In C, what happened is that you first have the first element. In this case, you are going to have comminuted. It is comminuted when you have comminuted with the fragments which are like this, that are rotated. So you are going to have fragments which are rotated like that. Is it clear? You have multiple fragments. This is the lower part here. It is comminuted with multiple fragments, but in this case, the fragments are not going out of the borders of the wound of the fracture. Is it clear? They are rotated, but they are still within the borders of the fracture. Is it clear? In that case, where you have this comminuted, is called a spiral comminuted. Are you understanding? Your spiral comminuted fracture is it clear? Correspond to 1. Are you understanding? The second one, after the spiral comminuted, you have a fracture now, but in this case, it is not comminuted. There's just a bone in the middle like that, a rectangular bone in the middle, or a square bone in the middle like that. Is it clear? When you have a rectangular or square bone in the middle like that, it is called a segmental wedge, a segmental fracture. Is it clear? It's called a segmental fracture. And lastly, when you have a fracture with the middle, you have many bones, comminuted bones, which are even going out of the borders of the wound. Is it clear? Out of the border of the fracture site, you have the other bone here. You have the bony fragment going out of the border. Here is going to be called irregular comminuted. Is it clear? It is called irregular comminuted. Now, spiral comminuted corresponds to 1, segmental fracture corresponds to 2, and then irregular comminuted corresponds to 3. So if you have a patient that has a spiral comminuted fracture, it is C1. If you have a patient that has a segmental fracture, it corresponds to C2. If you have a patient that has an irregular comminuted fracture, it corresponds to C3. So let's take an example for us to know if you have understood this. So if you receive a patient that has a humeral fracture, you receive a patient that has a humeral fracture, is it clear? Humeral fracture of the shaft, is it clear? And that fracture is a transverse fracture. If you have a patient that has a transverse fracture of the humeral shaft, what is the AO classification? The first thing is to ask yourself, the humerus is number how many? Humerus corresponds to number 1. Now, the next element is the shaft. The shaft is the middle part. Is it clear? So it corresponds to the middle third. So it's already number 2. Is it clear? Now, the next point is it's a transverse fracture. And when we say transverse fracture, you have to ask yourself how many fragments are there. Generally, when you just say transverse fracture, it means that there is no fragment. If there is no fragment, it already corresponds to A. Is it clear? And now the transverse corresponds to 3. So you are going to have 1, 2, A, 3. This is the conventional notation of a patient having a humeral shaft transverse fracture. Are you understanding? Now, let's have another case. You have a patient that has a fibular fracture on the proximal third. He has a fibular fracture at the level of the knee. Let's make it complicated. He has a fibular fracture at the level of the knee, level of the knee. Are you understanding? Fibular fracture at the level of the knee, which is a comminuted irregular fracture. Is it clear? You have a comminuted irregular fracture. So in this case, fibula corresponds to which part? Corresponds to number 4. Is it clear? Fibula corresponds to number 4. Now the next one, it is which part? It is at the level of the knee, so it's proximal third. So it corresponds to number 1. After the proximal third, we are going to have an irregular comminuted. So it's first comminuted. Comminuted means that it is C, and it is also irregular. Since it is irregular, it's going to correspond to 3. So it is 4-1-C3. Basically, that is just a simple notation for the AO classification. Now, the last thing now is if you have a patient that has a tibial plate fracture. You have a patient that has a tibial plate fracture. Understand very well. You have a patient that has a tibial plate fracture, basically, and then it is a bending wedge. A patient having a tibial plate fracture, it is a bending wedge. Is it clear? Now, tibia corresponds to what? Corresponds to still number 4. Are you understanding? The tibial plate is located where? Is it proximal, is it middle, or is it distal? It is proximal. So it's located at the proximal third. So you are going to put number 1. Now you are going to have a wedge fracture. A wedge fracture now corresponds to B, and then we said that it is bending. The first wedge, that was it is spiral wedge. Second wedge is the bending wedge, that's 2, and then the third wedge is multi-fragmentary wave, but this one is bending wave, so it's corresponding to number 2. So those are how you give example and have notations basically. So those are the notation for AO classification. The next thing you're going to visualize now is open fractures.